Take Charge Parenting with the Kids Doctor is brought to you by Children's Health.
From football to lacrosse, cheerleading to soccer, concussions pose a serious threat to young athletes whose brains are still developing. And here to help you keep your kids in the game and safe, Dr. Sue Hubbard, an award-winning pediatrician and medical editor of KidsDoctor.com, and Dr. Tanya Sabo, a pediatric neurologist, assistant professor at UT Southwestern Medical Center, and medical director of concussion services at Children's Health. Welcome. Nice to have you both here. This is a timely subject, Dr. Sue. Concussions, as we were just talking, our kids both played football, a really hot topic this time of year.
It's a really hot topic, and I think you need to know what a concussion is, Jane. And a concussion is a trauma-induced alteration in mental status, and it may occur with or without loss of consciousness, so that's important. And then it's also a functional brain abnormality, injury to the brain rather than structural, which is important for parents to understand because Dr. Sabo is the expert here that's going to talk to us, but it's not always something you see on a CT scan or MRI.
Okay, so Dr. Sabo, how likely is it, first of all, that a young athlete, got all these kids out there playing all kinds of sports, they're going to sustain a concussion while playing a contact sport?
Right. Approximately 1/5, excuse me, of athletes can sustain it. 1/5. Up to 300,000 athletes per year have that.
Okay,
do that.
So what are the warning signs, if you're a parent, what are the warning signs that your child may have suffered a concussion?
Excuse me, yes. On the field, the patient may appear dazed or confused, may have behavior changes, may lose consciousness even briefly, nausea, vomiting, and slow reaction time.
Okay, Dr. Sue, so once this has happened, how are concussions treated these days? What's the latest on that?
Well, the biggest thing is time and rest, and Dr. Sabo and I were talking about this before the segment, and gradual return to learn and then to play. So why don't you elaborate on that a bit for us?
Well, sure. I think it's hard for the athletes to bring things down a notch, and so really that rest is important. The brain needs time to heal, and the reaction time is going to be not as good on the field if the brain is not recovered as well as it should be.
So you're talking about rest time. When should a child then return? When and how do you know?
There's many measures we use, and one of the biggest things is we might be doing baseline cognitive screening on kids to kind of see where they are. And then there's some newer things I'd like Dr. Sabo to speak to that we're looking at.
Yes, absolutely. To know the child before the injury is very important, and so we always look at the eyes, we look at how the person is thinking and their balance. And so to have this baseline assessment is helpful to see post-injury how they're doing. And now we have other functional neuroimaging techniques that are showing us the recovery time of the brain after injury really does linger past you know, the time when the patient may appear well.
Well, and we've had boys, like we were saying, and they're like, oh, I'm fine, I want to go out and play. What is the risk of returning to practice or playing too soon?
Yeah, the biggest risk is what we call second impact syndrome, where the brain may have some unusual swelling or reaction to being hit again when that metabolism isn't quite working as fast as it should. And then we have also risk for re-injury. And so we know that the patients that often will do things not as athletically skilled as they used to. So it is important, you know, within that 24-48 hours to get assessed, you know, from their concussion, to be brought in to see how they are doing with their recovery.
So here's the million-dollar question. Is there any way to prevent a concussion?
Unfortunately, not totally. Is that correct? The expert here.
Yes, I think the helmets sometimes give us a false safety. I have some, there's no way to prevent it. It can prevent a skull fracture. Proper athletic training and practice techniques in less contact in play and practice as possible. You know, not every practice has to have contact.
And I'm just going to assume here the best thing to do is have a conversation with your kid before they start playing sports this fall about all this, right?
I think that's really important. And to talk about getting some baseline testing would be really a good advice.
All right. Thank you both for being here. Like we said, important subject. For more expert advice, you can visit childrens.com/concussions. You can also follow Children's Health and the Kids Doctor on Twitter and on Facebook.
Just like you're always by your child's side, we're Children's Health, and we're by your side. Visit any of our 40 locations for exceptional pediatric care.